Good day. Today I'm going to show you different positions for upper GI series and different central rays for different body positions. So please keep on watching. So here what I'm showing you is the patient in RAO position or right anterior oblique position for the upper GI series. As you can notice, there is a lead impregnated apron shielding her reproductive organ because the reproductive organ is highly sensitive to radiation exposure. Today I'm going to discuss about the CR or central ray of the RAO position. Just imagining that this is an RAO position of the patient. So for the standing type of the body, the central ray is in the midline of or between the spine and the upside lateral border of the abdomen. And we put the central ray at the level of L1. So L1, we can determine that by palpating the lower border of the rib 1 to 2 inches above. So this is the lower border of the rib, 1 to 2 inches above. This is the L1. So we put the central ray at the midline between the spine and the abdominal lateral abdominal border. So we put the central ray in here. Next type of the body is the asthenic type. So for the asthenic type, the organs are more adjacent. So the central ray is about 2 inches below the L1. So we determined that this is the L1, 2 inches below the L1. This is the place for central ray. So again, this is the midline between the spine and the lateral border of the abdomen. So we place the central ray here. Lastly is for hypersthenic. Hypersthenic body organs are more transverse. So the central ray is about 2 inches above the L1, nearer to the midline. So we identify this as the L1, 2 inches above. So imagine that this is in here, 2 inches above the L1 and nearer the midline. So it should be in here. So just near the midline, and also we include the lateral border of the abdomen. So that should be in just here. This is for the central ray of the hypersthenic body in RAO. Next position is the LPO position. Here, when the double contrast technique is used, the air-filled pylorus and the duodenal bulb may be better demonstrate signs of gastritis and ulcers. The technical factors that we use is a minimum of SID 40 inches. IR size is 24 by 30 centimeters or 30 by 35 centimeters. So here I'm going to discuss about the central ray for LPO position. Just imagining that this patient is in LPO position already. So for standing type of the body, the center would be at the level of L1, that is about the midway between the xiphoid tip and lower lateral margin of the ribs, and midway between the midline of the body and left lateral margin of the abdomen. So this is the xiphoid tip and this is the left lateral margin of the abdomen. So we put the central ray in between them. So midway between the midline of the body and the lateral border of the abdomen. Next is for hypersthenic body of the patient. We center the ray about 2 inches above the L1. Imagining that this patient is again in oblique position already, so 60 degrees oblique. Center about 2 inches above. So this is the L1. Since for hypersthenic, the body is more transverse. Center about 2 inches above. So we will measure from L1 2 inches above. So this is 2 inches above the L1, and between the midline and the lateral border again. So this is where we put the central ray for the hyperstenic patients. The last one is for asthenic patients. So again, for asthenic patients, the body organs are more adjacent. We center the ray about 2 inches below the L1 and nearer to the midline. So this is the L1. We will measure at least 2 inches below, nearer to the midline. So not really in the middle or in between the midline and the lateral border, but just nearer the midline. So we will assume that this is where we put the central ray for the asthenic patient in this LPO position. So here I'm going to discuss about the central ray for the right lateral position. For the first body type is asthenic. Here we will locate first the L1. So we will determine that by palpating the lower lateral margin of the ribs. So here. And we will center this ray 1.5 inches anterior to the coronal plane. So that is where we center the ray in this body type of habitus. Next is for hyperstenic patient. For hyperstenic patient, first we will locate the L1 again. So that's here. And then we will center it about 2 inches. 2 inches above the central or the L1. So that should be here. This is where we center the ray for hyperstenic patients, because for hyperstenic patients, the organs are higher and more transverse. Lastly is for asthenic. So just imagining that this patient is asthenic, we center the ray about 2 inches below the L1. So again, this is where the L1 is. We will measure at least 2 inches, and then that is where we point the central ray for asthenic patients. Yep, so that's all for today. That is the central ray of different body habitus for upper GI series. Thank you and have a nice day.